This week we're exploring solutions in communities all across the country about our children's mental health. Mental illness in children can be hard for parents to identify, and as a result, many children don't get the help that they need. And according to Mental Health America, more than 60% of youth with major depression don't receive any mental health treatment. And on top of that, there is a severe shortage of child psychiatrists. That's according to the American Academy of Child and Adolescent Psychiatry. And joining me now is Dr. Victor Carrion from Stanford Healthcare. So, Doctor, thanks for joining us. So, what are the warning signs of mental health in children that parents should be watching out for?
Yes, Ryan, good morning. This is really a big problem, as you have pointed out, and the pandemic really has just made it worse with the isolation and stress that it has caused. In general, we want to look for changes in behavior, any change in personality, any change in mood, any change from baseline. And we want to approach these developmentally as well. So preschoolers, school-age children, adolescents may actually behave differently and express differently their symptoms. In preschoolers, we may see some regression of behaviors, so some increased thumb sucking, bedwetting, increased fears. In school-age children, we may see headaches, stomach aches. In adolescents, we see them becoming more withdrawn, avoiding social interactions, avoiding or missing school, for example. But in general, any change in diet, any change in weight, in sleep, for example, may point that there might be a problem. And then very clear signs like either hurting themselves or talking about hurting themselves or talking about death and suicide. And of course, sadness and irritability.
So how do doctors actually diagnose mental illness in children, and how exactly is it treated?
Well, the point of entry usually is your primary doctor, your pediatrician, who will then consult with a therapist, a psychologist, a psychiatrist, who will do a comprehensive interview. And in this interview, to both the child and the caretakers, we will gather information on family history, on social history, academic history, medical history, and see how that function is altered. So, for example, any signs of distress, any signs that socially things have changed, or academically things have changed. And rather than anchoring in a diagnosis, what we're looking for is target symptoms that actually may interfere with the function. This is usually a process that is biological, psychological, and social. So biologically, we will look at things like nutrition, sleep rhythm, a medical exam. Psychologically, we will look at things like mood, changes in behavior, in cognition, and socially, any engagement, motivation, and so forth.
And how young are we talking?
Oh, these can manifest at any age. What happens with the preschoolers, for example, is that they manifest it differently. They may manifest it with some regression of their behaviors. Parents shouldn't be concerned about approaching these subjects with children. They should actually ask them and talk to them. And even if they don't want to talk, at least they know that the lines of communication are open for when they are ready to talk.
And so if you're a parent and you have a child with some mental health issues, how can you help your child cope? What should I do as a parent?
Well, after getting some of the help that I've mentioned, I think it's very important to inform oneself about the condition that we may be talking about or the symptoms that we are talking about and what they mean. Also, it's important to model to the child self-care and wellness. To exercise, to have good nutrition, to not use drugs and alcohol, to have adequate sleep, and also stress management techniques, things like mindfulness, for example. Parents can also become engaged and communicate, like I mentioned, leave those doors of communication open, but not only with the child, also with the school and other groups that can provide support, like the treatment team, for example. Parents should also be patient. Sometimes this takes time. The brain is a complex organ, and it can have some difficulties. But seeking advice and help is very important, remembering that you're not alone.
And you had mentioned COVID and isolation impacting some of the younger children. For some of the older children, how much does social media and that role play?
Well, social media it's a tool that was there when they needed it, right? During the pandemic. And like every tool, it can have its benefits and it can have its challenges. It is important for us to teach children how to actually use these tools. So very much how when they were very little and we were teaching them how to use a hammer and what a hammer was not for, the same with social media.
All right, well, thank you very much, Dr. Victor Carrion with Stanford Healthcare. Always good information. Thank you once again for joining us.
Thank you, Ryan.
Well, if you or someone you know is in a crisis, get help from the Suicide and Crisis Lifeline by calling or texting 988. And to hear candidly from youth about their struggles with mental health, we will show you a powerful documentary. It's on our stream Wednesday night at 7:30.